Good morning, Buffs. Rosie Lucio here, reporting from your favorite Buff News outlet, Channel 2. Today we are diving into schizotypal personality disorder, a disorder that seems to have effect on those entering early adulthood. We begin today's discussion taking a quick look at schizophrenia spectrum disorder, a disorder that is commonly associated with STPD. Schizophrenia is a widespread pattern of social disengagement as someone that illustrates limited expression in social situations, as mentioned in the DSM-5-TR. Also, in accordance with the DSM-5-TR, STPD displays a chronic pattern of social and interpersonal deficiencies that can manifest in multiple ways. Factors vary regarding the criteria that STPD is recognized, making it difficult to gather accurate and contemporary findings. Next, we have Destiny and Haley with the symptomology and diagnostics for STPD.
From the American Psychiatric Association shows crucial characteristics of STPD and 9 diagnostic features. Criteria 1 is ideas of reference. Those with STPD believe that daily experiences have hidden meanings directed towards them, different from magical thinking. This is criteria 2. Superstitious individuals believe in abilities such as clairvoyance. Believing in intuitions or having illusions is criteria 3. Unusual perceptual experiences. Having odd thoughts or speech, criteria 4, can cause one to sound incoherent. STPD can cause an individual to be suspicious and untrusting, criteria 5. Unsuccessful relationships due to an inability to express emotions and interact with others is considered as criteria 6, inappropriate or constricted affect. An individual with messy clothing, awkward behaviors who avoids eye contact reflects criteria 7, an odd or eccentric appearance or behavior. An individual with STPD can be uncomfortable relating to others. Social anxiety makes it difficult for a relationship outside of immediate family. The lack of close friends is criteria 8. Interaction at social gatherings with unknown individuals can cause social anxiety resulting in paranoid fears, known as diagnostic criteria 9. Now to Haley.
That's a great overview. Additionally, while individuals may have close relationships, these connections often feel strained due to their unusual thought patterns and behaviors. The diagnostic criteria for STPD, as highlighted in recent research, remain a challenge. Studies evaluating these criteria have used various clinical diagnostic tools and questionnaires, leading to inconsistencies in outcome measures. The research also points to significant heterogeneity in disease severity across studies, making it difficult to adopt a meta-analytical approach. This complexity emphasizes the need for standardized diagnostic tools and criteria to improve the accuracy and consistency of STPD diagnosis. It's fascinating how nuanced this disorder is. A better understanding can lead to more effective support for those impacted by this complex disorder. We will continue to update you as more information becomes available. Back to you, Rosie.
Thank you for that conclusion on those diagnostics. Now handing it over to Katie, who is discussing more on recent studies.
Thank you, Rosie. Francis and Torco found that STPD affects about 1 to 4% of people, with symptoms often like other illnesses. This overlap can lead to early or incorrect diagnoses. While most people are diagnosed in their 20s, kids and teens of any gender can also show symptoms. It's easy to see how this condition might be misdiagnosed, but don't worry. Having social difficulties doesn't mean you have STPD. However, if your brain's putamen volume is smaller than that of a schizophrenic patient in Roslow's 2014 study, you may have the condition. Back to you, Rosie.
Thank you, Katie, with those statistics. Next, moving to Brianna and Gracie, reporting on those treatment options.
Thank you, Rosie. So, Brianna, what is the therapeutic side of treatment?
While treatment options for STPD is limited, in 2016, Renoir discussed the findings on how psychodynamic with supportive therapy. Going into this treatment, the therapist and client with STPD must build a rapport. Oftentimes, people with STPD lack trust, but when that trust is built, ensure that it remains professional. Keep in mind, this process could take time. As treatment progresses, now would be the time to address any anxiety to minimize the magical thinking. This could better assist how they may be feeling. Now we can approach building better bonds with others, getting to the root of why building relationships is difficult. This is going to consist of learning how to appropriately address feelings in healthy ways towards people as well. While this approach has shown success, there has been very little conducted to ensure high success rates. In conclusion, this treatment can have success, but will be a timely approach and require dedication from both the client and therapist.
Study done by Kirchner researched about 22 drug studies on the drug intervention for the schizotypal disorder. They studied antipsychotic and antidepressant treatments. These treatments included olanzapine, fluoxetine, and many other treatments. However, the drug treatment that proved most effective was the risperidone. For this study, they did a 9-week randomized approach, which involved 25 STPD participants. They are separated into 3 groups: the treatment, placebo, and control. They found the dose of 0.25 milligrams a day relieved symptoms such as illusions, anxiety, and compulsive and obsessive compulsion. Overall, the pharmacological side should be studied more. However, the antipsychotics, if used, have been proved to limit symptoms in schizotypal disorder. Thank you.
See you next time.